All right. Hey, everyone. Good evening. I hope everyone is having a wonderful evening so far. If you're an avid Blue Jay fan like myself, I hope you recovered. I haven't, so I'm still pretty sad about this weekend. Um, but without further ado, we will begin our webinar. My name is Jason Demano, and I'm the Student Recruitment Officer here at the Michener Institute. My job primarily is to promote the programs here at the institution. We have 10 very unique specialized programs. Typically, you'll see myself at fairs, high school fairs, webinars like these, campus tours, and love to meet you. If we meet some of you already on the road, thank you for coming. I'd like to introduce our two lovely panelists. We have Cherry. She is our student recruitment coordinator, and I work very closely with her. And we also have a student from the Cardiovascular Perfusion program. We have Rachel, and she's going to share her expertise and her experiences with the program. Let us begin the presentation. I'd like to start off with the land acknowledgements. Um, the sacred land on which the Michener Institute operates has been and continues to be the traditional territory of the Huron-Wendat, the Seneca, and the Mississaugas of the Credit River, among many unnamed and unrecognized indigenous communities. Michener stands on land protected by the Dish with One Spoon Treaty between the Anishinaabe, Mississaugas, and Haudenosaunee that bound them to share the territory and protect the land. We recognize that this agreement is not a thing of the past, but a promise that we honor today and into the future. We share the responsibilities of taking care of this land and transforming our personal and institutional relationships. We acknowledge that this is our collective responsibility to strengthen our ties within the communities we serve and practice healthcare in a way that advances the Truth and Reconciliation Commission's seventh health-related recommendations. So exactly what is cardiovascular perfusion? Now, it's all about life-sustaining process of circulating oxygenated blood and to the body's organs and tissues. And essentially, what perfusionist does essentially is being in the operating room during open heart surgery, assisting the surgeon and assisting working alongside the anesthesiologist, and their job is to monitor the patients during open heart surgery. That's one of their main duties. Monitor their pulse, make sure that they're still alive, and keeping them alive in any way they can. It is a very intense program. Uh, pr it's an intense career, but it's definitely rewarding in the end because in many ways you are saving a lot of lives and also transforming lives as well. And essentially, I'd like to pass it over to Rachel, where she can give a little bit more insight on the program and really share what it's like the daily life of a cardiovascular perfusion students. So, Rachel, thank you once again for joining us this evening. We know it is a busy schedule of yours, but we really appreciate you being here. And I would like to start off with three questions for you. So, as a student of the cardiovascular perfusion program, what is the typical day like for you?
Yeah, well, thanks for having me. A typical day, so I'm in my first year, my first semester. So first semester for a perfusion student is mostly online classes. We did start with labs like in the first week. So like that's like one in-person lab a week. And then the rest of my classes are through tutorials and kind of like self-directed learning. So this semester I have physiology, chemotherapy, perfusion theory, and patient care and professionalism. So like a typical day for me would be to just I guess like what did I do today? I did my physiology lectures and then later on I have my physiology tutorial like later tonight. And then I just did some work for my lab, which is tomorrow morning. So yeah, it kind of changes day to day, but it's a lot of like self like staying on top of it since like most of the school is like at home. But you do have like those lab times where you get to put everything into practice.
Amazing. Now, I know it's you're only a couple months into the program. But so far, what would you say is your favorite part of this program and what interests you the most?
Yeah, I think that it's like a very like highly specialized program and area. It's like extremely niche, so like you learn so much about such a specific topic, which is like what I've really been liking so far. Like you become a little bit of an expert. I guess I haven't been doing it for that long, but like the amount that we've like learned has been a lot, which is great. And then recently most of our class was just able to get in to do like shadowing and like observerships. So I was in the past like couple weeks, I did two like full day observerships at Toronto hospitals, where I got to watch perfusionists like actually in action. So that was an amazing part of the program because everything that I've learned like in labs and in class, I was actually like able to see and go in there and see the surgeons and open heart surgery. So it was pretty cool.
Oh, that's fantastic. The opportunity that you're getting with this program and also the learning experience. Now, for those who are interested in applying for the program, like many of our programs here at Michener, they're highly competitive. Do you have any tips on how to do well in the admission process?
Yeah, so I actually applied once before getting in, and I didn't get in immediately because I applied right out of my undergrad. But like for me, like I still matched all the requirements. It's just like I needed a little bit more work experience and like other things to kind of make maybe my profile a bit more like unique and like bring some different skills. So I ended up doing like another program. I did another master's program and then worked at a hospital for a bit to like get more experience. And then I reapplied again and I ended up getting in, which was amazing. So I would say like this is like something that I really wanted to do personally. So I kind of stuck with it and just did what I could to like beef up my resume. And then yeah, and it worked out for me in the end. So I guess like if this is what you want to do, then stick with it and it'll work out.
Awesome. Thank you so much for sharing that, Rachel. Now we're gonna get to the fun part of the webinar. It is the Q&A. So those of you who are watching right now, if you have any questions, please put them in the Q&A chats. And we're gonna have Cherry kind of lead this part of the webinar. So Cherry, the floor is all yours. Thank you.
And thank you, Rachel. That was really informative from a student's perspective. So we do have one question right now. It relates to your first year or first term experience, Rachel, regarding the lecture. So is it entirely online except for one class on campus per week, or does it involve other in-person components? So how does it look like?
Um, so yeah, pretty much it's like entirely online from I would say like all of September. It was mostly online except for my one lab that was on Tuesdays. So I have a Tuesday morning lab. It's a 3 hour lab from 9 to 12, which is a lot of time in the lab where we actually got to like learn a lot. Um, I would say starting October, we started doing in-person patient care and professionalism labs also. So that was also like in combined with an online component. So we have like online class and then we would apply that. So this week I had drug administration lab also. So I was last week I was in person 2 days. So I had a 3 hour normal lab and then I had a 3 hour drug administration lab where we had like a guest lecturer come in and teach us that.
Well, thanks, Rachel. So I hope, Andrew, this answers your question. The next question is whether you did any shadowing of a cardiovascular perfusionist before applying. So, Rachel.
Yeah. So before applying, I shadowed a perfusionist at London Health Sciences Center while I was doing my undergrad at Western. And I just did like a one full day shadow.
Okay, perfect. Thank you. The next question is about your GPA and CASPA score, if you're comfortable sharing.
Yeah, so I scored fourth quartile on the Casper. I think my GPA may have been like around like 3.8. Um, that was like my personal score. I do know like other people in my class all have different experiences. Like I know people who got into the program who got second quartile on Casper. So it definitely is like a big range. And I would say like if you are someone who has more clinical experience, then that's definitely more heavily weighted compared to Casper.
Yeah, thanks, Rachel. Just to add on that, it's different each year. We rank our applicants depending on the GPA, CASPER scores, and also experience checklist. So even though Rachel shared her GPA and also her CASPER quartile, it doesn't mean like you have to score the same in order to get into the program. It's different every year, and it really depends on the pool of candidates of that year. Another question asking about whether you recommend getting shadowing experience in undergrad.
Yeah, I would like highly recommend that. Well, for starters, like you need to know if you're okay with like being in like the OR environment, like that kind like blood and like seeing those kinds of things like isn't for everyone. Like you totally need to, I would say like you should experience that before you commit to a program where like that's like the job. And you pretty quickly are like kind of like you are like in really heavily involved in that. So yeah, I would totally recommend. It's also nice to like know people who are already working as a perfusionist. You can ask them questions about their work life, etc. So yeah, I highly recommend that.
Yeah, thank you. Another question from Michelle. Are any of your classmates international or from the USA?
I have one classmate from the USA, yeah.
Okay, perfect. Yeah, so it's also different every year, depending on the application pool, but we definitely accept international students in our full-time programs. Another question is, what undergraduate program did you do and what master program did you did to complete to add on to your resume?
Yeah, so I did medical science at Western. I did IMS. And then I did my master's at Western also in management of applied science. So kind of like a healthcare management 1 year program. Yeah.
Thanks, Rachel. What proportion of students are either RN or RT versus bachelor science undergrad? So maybe you can share your experience in class.
Yeah, it seems like majority of my classmates are RNs. I would say like a big proportion of the class is certainly clinical. Only a few of us aren't clinical, like can have maybe just a bachelor's and like some work experience, maybe in industry or research. And then a few students are RTs. I feel like maybe I'm trying to think like maybe like a couple like two or three are RTs, but many are nurses and have a lot of clinical experience. So that's nice.
Yeah. Are the online lectures asynchronous or synchronous?
So asynchronous for like the work that you have to do. So like my professor will post, so this week is week 10. So for physiology, we had like 2 lecture videos posted that was like asynchronous. So you complete that and then we have synchronous tutorials where the professor goes over all the lecture material. You can ask questions. Mhm.
Okay, thank you. So we're being mindful of the time. We're only scheduled for 6:15. If anyone has any other questions related to student experience or even admission requirement, our admission team actually do consultation. So if you're unsure whether your transcript or your courses meet the requirements, or if your experience meets the checklist requirements, feel free to send us an email at admissions@michener.ca. We also have other webinar sessions upcoming. We have a Michener Monday series. So if Jason, you can move on to the slide of that and show everyone, that would be great. We also have a drop-in Ask Me session where we can have a one-on-one individual consultation for you. So for those who ask a lot of questions in our chat, not in the Q&A section, feel free to drop in. It's every Friday at 1 to 2 p.m. We have our admission officers and recruitment coordinator and officers in the meeting to answer any specific and in-depth questions that you may have. And apologies if we can't address everyone's question today as the time is limited. But we also have our phone line operating Tuesday to Thursday. Feel free to call our staff and we'll answer your general questions. You can also connect to a admission officer in that case as well. Moving on, we also, as I mentioned, we have a Michener Monday series. So if you're interested in any other programs that we have, Jason, if you can move on to the next slide, please. We have a series of other programs that we'll cover. And then we also have an open house scheduled November 22nd at 10 to 2 p.m. So feel free to drop by. The registration link is already open on our website, so you can come talk to our student ambassador, our faculty members, tour around our campus, take a look inside the labs and classrooms and simulation centers so you know where you'll be having classes if you're in our program. And once again, thank you everyone for joining and thank you all for your time. Thanks Rachel and Jason for hosting this. We look forward to seeing you in our future events. Thanks everyone.
Take care, everyone. Have a good
Thank
night.
you.